All right, we're live.
Hello, and welcome to another episode of Health and Wellness with Dr. Praise. As always, remember all the information that we talk about here is just for informational purposes only. This is not supposed to replace advice that's given by your physician or healthcare provider. So if you have any questions pertaining to your health, please contact your healthcare provider and do not stop taking your medications based on what we talk about here, or stop your treatment based on what we talk about here. What we talk about here is just for informational purposes only and for educational purposes. Today, we are going to be delving into the topic of HIV/AIDS. We are going to be talking about that, and I have a wonderful group of women as panelists today who are going to share with me as we talk about growing up in Zimbabwe in the 80s and 90s. I was born in 1981, so I was one of the first to start the 80s, so to speak. And I know my sister who's on the panel was born in 1980, so she can claim that she was the first to start it. But we will be talking about growing up in the 80s and 90s and how HIV/AIDS epidemic affected each and every one of us, because we all know that a whole generation was wiped out. We all know somebody who suffered and who died from AIDS, and we know people who struggled with the stigma associated with HIV, and we want to destigmatize HIV. I want people to start looking at it as any other illness, because there are so many people who, after getting an HIV diagnosis, think that their whole life is over, and they think, I talk to young women who would say to me, well, who's going to love me now? I'm never going to have a family. I'm never going to live a fulfilled life. And I want those people to understand that it is not so. So I will start by having each and every one of our wonderful panelists introduce themselves. Let's start with Leader Melody, and then we'll go to my sister Titi, and we'll go to my mama Noku, and then we'll go to my partner, as you all know, my wonderful partner Patience, and of course everybody knows Estelle. Go ahead. Leader Melody, I can't hear you. Are you muted?
Yes. Can you hear me?
Yes, I can hear you now.
Okay. My name is Melody. How are you, everyone? Can you hear me?
Yes, we can.
Yes, I was born in 1982. So I also grew up in the 1980s. So when we grew up, by that time we didn't know, we didn't have any idea about AIDS. So it was meant like a death sentence. When you get AIDS, you went to the hospital and they tell you that you're HIV positive. So it was like death sentence, and people couldn't accept it. So we didn't have the knowledge about how it was spread. That's why when you grow up, like wenzi usabate ntiro yamkoma vane AIDS, ispuni ndeya budi, like I remember my mother's sister, your son had the disease. So he used to have his own plate, his own cup, his own spoon, So it was so bad because we didn't have the knowledge. So also health promotion was very poor by the time. So, and that time it had the HIV, the AIDS, physical symptoms like kuyerera vhudzi. Then someone will get small, and very thin. Zvekuti you would say you wouldn't even want to go near that person.
Mm-hmm.
Like nowadays, it's so difficult to see, like to know this person has got HIV.
Yes.
Thank you. Thank you.
Hello.
Bye.
Okay. Hi, everyone. My name is Sixty Zireva Prince, and I grew up in Harare, um, born 1980. So, yes, I'm probably one of we grew up within that time where HIV had started, but it was very much not spoken about.
Yes.
Um, Having had family members living with HIV and succumbed to the disease, it became something that I became a little more passionate about, and I guess you'll hear a little more, with that within the talk. But it's definitely something very close to my heart.
Patience, can you hear us? Can you give a brief introduction of yourself? I know you're the baby.
Hi, I'm Patience Karuba. I'm glad to be back here again. I was born in 1987 in Philadelphia, so I am the baby here. And although I can't really say that in the 80s I was growing up and seeing things because I was obviously at that time. But one of the things that I do remember from that time, which has stayed with me up until recently, when I sat down and thought about this, it was the anxiety and fear because that was the one thing that was installed in me from a young age, that HIV AIDS is a total death sentence. You cannot touch a plate of a person who's got this disease. You can't go near them. You can't use the toilet. You can't. It was so much instilled in me that I thought, my goodness, even if a boy were to look at me, I'd probably get this AIDS. So it's one of those things that was put in me. It was like fear, and it took a lot for me to get to a point as a human rights practitioner to really try and understand and unearth these things, because it was something I saw in my family as well, because it's either you're infected or you are affected. So baby as I was at that point in time, but there definitely was a lot of mental impact and subconscious, negative subconscious teachings that I received. So I'm looking forward to unpacking this discussion, and I think it's also going to offer a lot of healing, as we move forward.
Yes, absolutely. Estelle, what's your growing up story?
Hi, and welcome to all our viewers and listeners. My name is Estella. I grew up in the 80s. I was a small kid in primary school in Harare, and so that means I was born in the 70s. I'm not going to say exactly which, yeah, but you get the idea, I'm sure. Um, HIV growing up as a small kid was one of those things that I heard adult people talking about, but in a very secretive way. It was something that I felt they worked hard to sort of hide from us, the small kids. They thought it would somehow psychologically damage us to hear about, relatives or friends who were suffering from the illness. So my first, I would say, my first personal experience with it was a movie. I can't even remember the name of that movie, but it was a big movie in that decade, in the 80s, and that was the first time I got to see what a person suffering from AIDS looked like. But my second experience was when I was much older. I think I was a teenager, and yeah, I was invited to come and see, and I think I will also get into that a little deeper as the program goes, as everybody else said. But before we move on, Dr. Praise, can I read a few comments from our our listeners on Facebook. Okay, we have Chuku Chisom says, that's great. Welcome to the show, Chuku. Simbarashe Muchanyu. I can
Yes,
fly to this.
Simbarasha Mchanyi should get into the show. He needs to get into the show and contribute if he's saying us babies cannot contribute.
Exactly. Can I post the link on Facebook? So
Yes. So
all
people,
right.
those who feel they have something to add on can join in.
All right, great. So Simbarashe Muchanyu, the challenge has been posed. Please do come in and uh, educate us. Adi Kajek says, everyone knew, but Mazimba hamumire kupinda pinda. um,
We will touch on
Pauline,
that.
my thoughts on that.
No, we will touch on that for
Oh,
sure.
we'll touch on that. All right, great. Absolutely. Pauline Machinji K is watching from Port Elizabeth, Eastern Cape, South Africa. Welcome to the show, Pauline. Mufamane Bronson Kurarama says, I'm watching from Dar es Salaam in Tanzania. Habari, hujambo. Welcome to the show, Karibu Sana. Emelda Kundishora says, good evening, watching from Pretoria. Warm welcome, Emelda. That's all we have, on the comments list. So handing over to you,
Wonderful.
Dr. Fred.
That's wonderful. Welcome everybody, and we just love having all our brothers and sisters in Zimbabwe and in the diaspora watching and joining in these conversations, because when we talk about health and wellness, we are not only talking about diseases, but we are talking about how we can be well as a community. And there are so many things that we can talk about that help us be well as a community. A lot of the things that we tend to not want to talk about, topics that are taboo, topics that have been thrown under the rugs, so to speak. So I am so glad that you guys are watching and enjoying. And yes, please, whatever you have to contribute, like I said before, the show is for us all. Nobody knows 100%. We all learn from each other. So just quick facts for, if we have young ones who are wondering what is HIV, what is AIDS. HIV is the virus that causes AIDS, which AIDS is basically a disease that causes the immune system to be weak. And so what ends up killing people who have AIDS, and AIDS is by definition basically what happens with your immune system. It's like the way I explain to grade school children is that the immune system is like soldiers in an army. They go to fight whatever diseases are there. And so when your immune system, your soldiers are weak, then they're not able to fight the diseases. And so what ends up killing people who have HIV or who have AIDS, when they become AIDS, which the definition based on how weak the immune system is, then is infections, what we call opportunistic infections. So basically, a virus is anything that can get into your system that can make you sick. So like the flu virus, for instance. And so, yes, there's a lot of research that goes into HIV. There've been a lot of work to try to come up with a vaccine and things like that. But in the United States, mostly when HIV started in the 80s, basically it was deemed a disease of the homosexuals, of people who were homosexual. And then in Zimbabwe, when AIDS was happening in our time, it was basically deemed a disease of prostitutes. So then you have the men who were in, let's say, the villages, they would go and work in town, and it was deemed that they would, these are people who have been having little houses or who are engaging in sexual acts with prostitutes, and then they bring the virus back home. But I want to also discuss that HIV, AIDS does not only affect prostitutes. There are people who lived normal, completely faithful lives, who had no part in anything that you would consider to be high risk behavior, who ended up with HIV and who ended up with AIDS. So let's talk a little bit more from just personal experiences, because when I left Zimbabwe we left Zimbabwe when it was 1995, and I can tell you that at that time we were in the thick of things, and 1 in 3 Zimbabwean adults was infected with the virus. And like I said before, we have a whole generation pretty much that was wiped out. We all know how it was funeral after funeral after funeral, but nobody was saying, how people died. Nobody was really coming out and saying, oh, they had AIDS. And we would start all these names. You guys remember the names that we were using for AIDS, and even just saying Chirwere chipi chacho, like we were not calling it for what it is. So tell me, you guys, chime in and tell me, what was your experience? Because what I remember was pretty bad. It seems like every week somebody was dying and there was a funeral. And I have relatives who died. I have relatives who still currently have HIV, but were able to get antiretrovirals and have been able to live completely normal lives. So let's chime in and let's discuss. Lida Melo, I can't hear you. You're muted. Okay.
Okay, can you hear me now? Can you hear me?
Yes.
So I think in the 80s, by that time, people were still happy and the economy was steady. So we used to have like cotton growers. So when people like in the rural areas, they grow their cotton, they went to the market, they sell, they get money, like they went to those pubs, the shabins at the village there. So people used to enjoy, and by that time there was no like child empowerment. We didn't have like the wives with no rights. They used to be submissive to their husbands. So you could find like when a man has got, like polygamist guys, like a man has got 3 wives, 4 wives. Even as a wife, you can see like your husband has got is like jolling next door, like he's sleeping with these people. You couldn't even ask anything. So that's what caused those husbands to go and to spread the disease. Like he can sleep with this woman, he goes to that woman, he goes to that woman. So there was limited power for women because it was like the man is the breadwinner, no questions asked. And by that time also we didn't have like condoms. It was very rare to find condoms in the like 80s. And I think zvaitotyisa kupinda mushop like to buy those protector plus. So that's why those guys, our fathers, our brothers, when they go to the shabin to drink, they will find girls there, they sleep with them without protecting. Then they come home, maybe has got like 3 wives. So it's obvious those 3 wives, all of them are infected. So it was difficult, and we didn't have child empowerment by that time. So also girls were used to be abused and get the virus. Thank you. To you, Chair.
Yes, and so Titi, what was your experience? What did you see growing up? Because you grew up in the low density suburbs. So what were you seeing during that time?
So I guess growing up in the 80s, it wasn't spoken about a lot. I knew very little about it. Like I think someone mentioned it, that our parents probably tried to protect us from even knowing about this disease or hearing about it, because or maybe they didn't even know about it personally. I feel like there was probably very little awareness back in the 80s. 90s, definitely there was a lot more awareness. And I think the lack of awareness is probably what caused a lot of this disease, to just spread. And like you said, like kill a lot of people because people didn't know about it. They didn't know it existed, and would obviously, like leader Nemo was talking about, go and be promiscuous. I think a lot of people would go out of the country, like in the Congo, and like the army and stuff like that, and come back to their families, and that was part of um, the spread from my knowledge. Um, Going back to 92, so I want to say like 1990. Um, I had an aunt, a very close aunt, that had the disease, but it was, like I said, it was hardly ever spoken about. I think for me to know that it was the disease, I probably only confirmed it as an adult. But I remember, the care was not the same. So, like, even taking care of her, the medical care was not the same as what we have right now. There was so much stigma towards it. Like, no one. I mean, I'm sure the kids didn't even know. My mom, everyone really didn't know, but doctors would even divulge all that information to, because I know for a fact my mom and my dad knew this information through the doctors. So there was nothing like HIPAA to protect these people. And I'm sure as an HIV positive person, they felt non-protected, no support. Like we're saying, people didn't know enough about it. So things like, sharing utensils, just the stigma that came with it, and people just trying to keep those people away from society to some extent. So growing up in the low densities of Harare, um, I saw very little of it. I think most of the people that I know that had it were more in the higher density. And I think it was not that they didn't have it in the low density, it was just a lot of not having that, like the hip hop to protect them, to protect the people in the higher densities, from other people knowing about it or stigmatizing against it. So lack of education was a really big thing. So I mean, yeah, there's quite a lot. I think I'm just, it's an emotional one.
It is it's hard because you see how people have suffered, and not only and how people have suffered emotionally, and how it has changed people's lives. It's like, even if you were not affected personally, as in you yourself were not diagnosed, but you saw it around you. And so it was such a big problem. And the problem is that, when looking at the statistics for our country, 84% was transmitted through sexual contact, 15% was transmitted from mother to child, and 1% was other, which I would say probably, sometimes people who had contact with bodily fluids, whether they were healthcare workers, whether they were family members taking care of one at home. Because I do know of a young girl who was taking care of her mother and who ended up contracting the disease because she had open sores, and she was taking care of her mom, but there was nobody who had even educated her on what needed to be done, or even provided gloves for her to be able to take care of her mother. And then the occasional blood transfusion, because in the 80s we weren't really testing the blood for all these things. So when looking back, what would you say would be, if you could just go back in time and see? Because when I looked at how, for instance, Uganda dealt with the situation in terms of education and awareness, they were able to combat the disease much quicker than we have been able to, because we have not been open. So in looking back, what would you say now, with all the knowledge that you have, what can we do to continue to put this on the forefront, so that we can continue to make it not a stigma, so that people can divulge that information, because if it's different if somebody didn't know that they are positive, but also they don't know they're positive because they didn't get tested. It's always
Yes.
very important for people to know their status, right? So it's been education. Know your status. If you know your status, now are you comfortable telling your partner that you have HIV, or is everybody going to run off or tell the whole world that, oh, I need you with it? Because problem is we like to gossip, and we like to gossip and talk about other people and talk about, oh, akazodai, akazodai, akazodai. So looking back for you guys, what do you say? What do you think would be something that you would have wanted to have happened in that time, and something that we can do now?
I think you hit it. Definitely education. If we had been better educated, I think the stigmatization might have been very or less. But as a people, I think even if you're educated, just like right now we're going through COVID, and there's still some form of stigma, especially in places like, I know in Zimbabwe, definitely, where there is some form of stigma where people don't really understand the disease. But I think the education would definitely help. With the stigma. I think definitely, like you said, education. That's like a big one.
Yes, I agree with you. And also, I think the person that gets like the virus, I think acceptance is very important. If you accept it, like you have the disease, you have the virus, that's when you get and people will teach you, will give you knowledge about how to look after yourself, about how to take your medicines, about like counseling. You get the counseling, you accept that how you are, you accept it, you get counseling. I think it will be easier for someone to open to someone like your wife, or your sister, your brother, your mom, like that's how it is. And also if people have the knowledge, this virus doesn't spread, we're like sharing stuff, then I think it will be fine.
Yes.
And I think no, go ahead.
Information is very important, and it needs to be at a level where we come down to a level where we can understand each other. Quite honest with you, there is still so much stigma attached to HIV and AIDS in this day.
Sorry, patience. Is it okay if I mute everyone at the moment?
Okay. Are we good?
Yes,
Nara,
go
do
ahead.
you mind muting your mic?
Okay.
All right. Okay, you can go ahead.
Okay. As I was saying, I think it's very important that for us to get the right information, and in a way that we can truly understand it, and in a way that causes us to be able to really express ourselves and ask questions and get all the information in a safe space, because the stigma is still there until this day and age. People are still very much against testing, and especially like my generation, they will tell you that, hey, at the end of the day, what doesn't kill you, everything is just going to kill you. And that's not an attitude to have. People are actually very afraid of finding out, because they're like, I rather not know, because the day that I go and test, and if I found out I'm positive, I'll start having a running stomach, I'll start having a rash and everything. And because now it's in your mind. So if we are counseled, whether we are HIV positive or not, to know and accept that it can be a choice of your lifestyle, and where it can actually prolong your life and you can actually live a high quality life, then I think it can also go a long way. We just tend to think that there's so much information about HIV, AIDS, and everything. But yes, there is information, but Are we really accepting it? Are we really taking it in? Are we really heeding their advice? Are we really taking the necessary precautions? You know, and we should normalize things like testing. We should normalize on a much larger scale. You know, like I said, as a young person, I'm 34, we have these conversations. And one time, like, I advocate for regular HIV testing, and someone said to me, well, one day you're going to find what you're looking for if you keep going to get tested. And I said, but no, that's not the attitude that you should have. So it also comes to us with young people that, you know, in this era, we live in an era of hookups right now. We live in an era of where relationships, you know, they also have this thing of umjolo, the pandemic. You know, they're also calling it that, you know, because there's so many things. It's random hookups these days. There's nothing wrong with sleeping with a person today and never speaking to them again tomorrow. This is the era that we are currently living in, where actually telling someone I have feelings for you is seen as something very, very, very taboo. But there's nothing wrong with having sex with that person. And 8 times out of 10, it's unprotected sex. We hooked up, we were at a party, we did whatever. So, yes, even in this generation that we're facing, we also have these challenges. And we should be able to come and say, you know what, guys, this is it. We might think that, okay, there's antiretroviral therapy, there's PrEP, there's everything else, but also look at it. Why are we doing these things? You know, maybe prioritize teachings on why is it so important to preserve your body in such a way. You know, going back to the basics and actually getting in touch with people on a one-on-one way. So, from my bit of advice or input that I've seen as a young person who's living in an era of instant hookups. Everything is instant. We can meet on a dating site, we click our pictures, we like each other, we hook up, we have drinks, we sleep together all in one night. I don't know your sexual history, I don't know your health, I don't know anything about you. And it's quite common. And you can laugh about it the next day and even post about it on social media. And there's nothing wrong with that. So we also, and in our era, we need to be cognizant, and we actually do need to realize that we're living in a very perilous time.
I think Nyarazo would like to contribute something. Would you like to unmute and contribute, Nyarazo? Or would you rather someone reads the comment that you sent in private chat? Okay, maybe I can do that for Nyarazo. I can read the comment that she sent in private chat. I'm just going to sorry, patience, I'm just going to mute you. So Nyarazo wrote, here is my contribution. Growing up in the 90s in a peri-urban setting in Zimbabwe was easy as the nation was reeling from the devastating effects of the HIV epidemic. Sexual networks influenced by polygamy and the wife inheritance cultural custom perpetuated the effects. Some would die with HIV, and the family sought African traditional means of getting to terms with the death of a loved one. They would be told the death has been caused by witchcraft. Socioeconomic issues too promoted prostitution, and the disease rampantly spread. The rest of the uninfected ones were affected by the death of the infected relatives and friends. People didn't want to share kitchen utensils with the infected or to socialize with them.
And that is, you know, and that's the thing, because if you see that, if you tell people that you have a disease and nobody wants to talk to you anymore, and the whole city knows that you have HIV, of course you're not going to talk about it. You're not going to say it. And that's another way that the disease was just being spread so much. And like Patience said, know your status is very important, but people do feel that if they know their status, if they are told they have HIV, then it's a death sentence. Whereas you have to know so that you can be treated. I tell patients that it's just like if you have high blood pressure or diabetes. If you don't take care of your high blood pressure or your diabetes, you're going to end up in renal failure. You're going to end up on dialysis, or you're going to end up dying or having a heart attack and dying. So you have to take care of yourself. And now that we have access to antiretrovirals, you can live with a high CD4 count, which is the soldiers that I was talking about to fight your infections. And you can live with a zero or non-detectable viral load and live a completely normal and healthy life. And with the guidance of physicians, those who want to have children, managed to have children, those who are married to partners who are HIV negative, have managed to find ways to have children in a safe way that is under the direction of a physician. So it's not a death sentence. It's not that you are not going to have all the things that you wanted to have. Think of all these children that were born to HIV positive mothers who were not on antiretrovirals, who were not getting the care of a physician, who ended up not getting a cesarean section because they, one, either didn't know, two, either they were in denial, or they were afraid of coming out and saying, I have this disease. And now they had children that were born with HIV, So it's like those children are growing up now. We are seeing those children are now in their 20s and 30s. So this is a problem that's still there in Zimbabwe. And we need to continue to talk and educate ourselves about it, because like Leader Melody said, when you look at people now, you can't tell that this person has HIV just by looking at them, but they could still transmit it to you. And like Patience was saying, in this hookup age where people are just hooking up, people think, oh, if they have HIV or you're going to be able to tell by how they look. No, you're not going to be able to tell by how they look. And you could be putting yourself in danger of, getting the virus. So there's a lot of education that needs to be done. Just because we have come a long way from where we were 33% infection rate to now about 13% infection rate does not mean that we're out of the woods. We still need to be vigilant, and we still need to be protected, and we still need to be taking care of ourselves. And with our healthcare system in Zimbabwe, even now, where people have access to antiretrovirals, I mean, what more can we do? We need to use those antiretrovirals. So what do you guys think in terms of advice to the young generation, to this hookup generation? As older sisters, what do you say to them, to the young women and to the young men? And obviously there are those instances where kids are being abused, sexually molested, sexually abused, and they have no say in it. But for those who are actually just going out there and having fun, what do you have to say to them?
You can unmute Leader Melody.
Okay. Hello.
We hear you now.
Okay. So, as the saying goes, like, there's this crazy funny saying, like, someone infected me with this virus. So I can't go alone. I can't go down alone. I can't die alone. I have to infect others. That's when you see, like, if it's a girl, she starts having like multiple boyfriends, just sleeping with them without even using protection. And also, like primary school kids are now sexually active, like 12-year-olds, 14-year-olds. Now there are many chances that they can get the virus. So the advice that we can give to these kids, we can say them kids because they are still young, but they are sexually active. They just have to protect themselves, because there's no way we can tell them, like, abstain from sex. We can't, because we are not with them 24 hours. but we just give them advice like use condoms, know your status. You can go get tested when you find a boyfriend, like a partner, you are in a relationship. I think the best way before you have sexual intercourse, you have to go get tested, know your status. Then also, there are some kids that are born with the virus from their parents, and they are shy, like you get in a relationship and is shy to tell his or her partner that I'm HIV positive. And if you say so, if he's open, then the first thing we all think is like, you find it yourself. You were like sleeping around. That's how you get the virus. But some were born with it, so it's difficult for someone to be open. Like I was born with this virus. So I think a serious counseling needs to be done when you are in a relationship. Go for counseling, get tested, know your status, and decide if you really want to go ahead to be in the relationship or to, Thank you.
I think definitely know your status. Number one, especially for that age group. Like you said, most of them were actually, well, not most HIV, um, I don't want to say children, adolescents born in the 90s were probably born to HIV positive. Not most, but I'm just saying, like the HIV positive ones now usually had it from transmission from their parent. Um, so the one thing I do tell my teenagers is, um, you know, my kids, I always tell them, listen, before you become sexually active, before you get married or whatever you decide, make sure you know that person's status. They didn't intentionally go looking for it. They might have been born with it. They probably never knew about it, or maybe they do know about it and they're probably shy about it or embarrassed or whatever it is. But you don't want to fall victim to that. And on the other hand, if you decide you want to go and be that discordant couple and get married to this person and you are a negative, I'm not a parent that will stop you from doing that. But I need you to take care of yourself. I need you to protect yourself. I need you to follow whatever the doctor's guidelines are. So discordant couples are very normal. I actually think they are more normal in Zimbabwe than they are here in the US. Zimbabwe has come a long way with HIV. Zimbabwe stigmatization. I don't live there right now, but I do frequent. I'm finding HIV is not a big deal. I feel like here in the US, it's probably more of a big deal. Being a nurse, I find a lot of discrimination. I'm a nurse in a predominantly white state. Very, yeah. I don't want to say non-progressive, but to a certain extent, some of the people can be a little bit less progressive than others. So HIV to them is, oh, no-go area. Oh my goodness, I have an HIV patient. Oh my goodness, this person has HIV. Like, how did you get it? You could tell the questions or the statements are more out of stigma and fear of not understanding what exactly is going on and not understanding the disease itself. I'm finding a lot of people, nurses in their 20s as well, just not having enough information here in the US. Whereas you take a 20-year-old in Zimbabwe, they know a lot more about HIV. I think it was definitely a silent disease back in the 90s. I feel like in the 2000s, things started changing. And that's around the time when I did live there. I do feel like, yes, there is stigmatization where people find it easy to degrade the next person based on their status. But I do feel Zimbabwe has definitely gone a long way. And I think my advice to these young kids is know your status. That's the first, the most important thing. Make sure you adhere to whatever medications or treatments your doctor has prescribed. Like You were saying, Dr. Praise, you can live with a viral load count less than 20, you know, CD4, high CD4 count, healthier than any other normal person, and live a very long life. I mean, I know people that, I know someone in particular who was diagnosed in 2004, and to date is living very well, discordant couple. They have beautiful children out of that relationship who, you know, and it can happen to anyone, basically. It can happen to the most careful person. It can happen in your marriage and you're as committed as you could be. I think back in the days, like you said, transmission through, like blood products, it was a thing. It was a thing. I feel like, they're doing a better job right now. They're doing a better job educating. Zimbabwe has definitely, 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 definitely done a lot in terms of HIV. I do feel like the first world countries need to do a little bit more in educating it. It feels like it is, like you said, definitely more a gay, or maybe not gay, more a associated with, either being, like homosexual, um, which is wrong. I mean, it can happen to anyone. It can happen to you no matter what age you are. As long as you're sexually active, it can definitely happen to you as well. So I just want to say people just need to know their status. Get tested as often as possible. If you're sexually active, maybe every 6 months if you have to. In Zimbabwe, it's free. They go to, I think, Wilkins. Doctors offer it. I'm not too sure what other clinics. I think Highlands Clinic offers it. But get counseling, get tested, stay on top of it. It's not a killer disease. It's a disease that can be controlled. It's a disease that there's so many resources. Take advantage of those, and some of them are actually very. I mean, most of them are free in Zimbabwe, whereas in the U.S. people are paying in the thousands for that type of medication. So if you're in Zimbabwe and you are living HIV positive, I say, take advantage of whatever you can get. They've got amazing drugs. Use them, live well, stay positive.
Yes. Yes, beautiful. Anyone else with anything else to add before we wrap up? I know that there's a comment here.
Okay. Can I just quickly add like one thing? Like I think also as well as parents, mothers, fathers, everyone. One thing, I have a daughter and she's a teenager. One thing that I would encourage is for us to begin to have frank and open and honest conversations with our children. And I believe that also institutions like the churches play a very pivotal role in making sure that the moral fiber of any community and the nation at large is being held up. So I think it's time we have these conversations where you don't just say, don't have sex. Now is the time for us to really get down to the nitty gritties and speak to our children. And let's be honest, because they're in a digital era, they're going to go on YouTube, they're going to go on so many various platforms. The internet is awash with so many things, and you don't want them getting the wrong information, or you don't want them getting the wrong end of the stick. So I think as parents now, I know in our culture it's taboo for us to even talk about sex. I know it's taboo for us to talk about all of these things. Also, that is why things like stigma, we're still dealing with them, because HIV AIDS was related to sex. You can't talk about such things. It's embarrassing. So, but now is the time where you would rather have conversations with your child that could save their life, or, that can help even prolong so many other different, so they don't experience things. Have conversations with them, develop open platforms in which they can speak to you, and leaders in the churches. Now is the time to take children aside and say, this is what it is. We as I as a Christian, and our organization, as much as we are a Christian organization, We don't advocate for premarital sex or advocate for promiscuity or anything like that. I would like to make that clear. But we also are cognizant of the fact that children as young as 12, 13, 14 are having sex, as Leader Melody did say. We are not with them 24 hours a day. But now is the time, open, honest, frank conversations. This is what is on the table, and how best can we deal with it? And we give them practical life skills in which they can handle whatever life is going to come at them. So I think that's just what I felt I needed to add as a teen mom.
Yes, that's beautiful because, that's uh, on our panel right now, three of us are teen moms, and it's like just telling a child don't have sex does not work, because you mothers out there, you fathers out there, you think just because you tell your child don't have sex and then you don't talk about it, that they are not having sex. I will break it down to you. Your children are having sex. So it's important for us to have these frank discussions with these children and to teach them what is responsible. We are not advocating for them to go and have sex, but if they do have sex, they should have the information that they need and the education that they need to have safe sex, because it's happening. How many of us see these young children who are becoming mothers, and so it's like it is very important. We need to talk to our girls, we need to talk to our boys, we need to talk to our children about safe sex.
And if I could add a little bit on top of that, I have noticed from my own personal experience, uh, between myself and my parents and myself and my children, that I was not so open to advice coming from my parents because we didn't have that kind of trust in our relationship. In our culture, we tend to use lies to get children to obey, to do the right thing. Maybe we can tell them about monsters or promise them something that we don't deliver after all. So what happens is a child learns not to trust the parent, and they grow up thinking that the parents just want to control me. So every time a parent is trying to advise the child thinks, well, there they go again. They just want to control my life. But I've noticed that with my children, having lived here for some time before having children, I learned that in this country, they teach children to operate based on reason. If they tell you don't do this, they tell you why you shouldn't do it. So every time a child is advised, there's a reason and a motive for them to take the advice. So they grow up understanding that when my parents are advising me, they have my best interests at heart. They are not trying to take control of my life. They're not trying to live their lives through me. So that is one thing that I would advise, especially young parents who are just starting out. Start out from when kids are very small. Train them to base every action, every decision on reason. And if they learn to to make decisions based on logic and information, even when you start to give them that information when they are older, they accept it and they put it to practice, because like in our country we have a lot of very educated people, but we do not put that education to practice. And I believe it is something to do with that way of raising, where information is something that, even at school, it's something that you need to understand, maybe to pass a test, to graduate, you get your certificate, but we never get to the application of this information. So just to generate that culture where we try to ensure that the information we receive filters through to the practically to influence the way that that we live our lives. I think that is something that would help our people, our country, in many different ways to live healthy, because at school we are taught all these things. do this, don't do that. But it is just knowledge for, for the exam. We've never been taught that this knowledge you're learning at school has to be put in practice every day in your life. Every decision you're making that concerns your life should be based on the knowledge that you have. So that's my small contribution that I would like to make. But I did notice that is her name Nyaradzo or Noku? I think you called her Noku, Dr. Praise.
Yes, I call her Noku.
All right. I noticed that Noku also had two other comments that she had posted here in private chat. And if it's okay with Noku, I'm not sure if Noku is hearing me. Would you like to read the comments or contribute? You're not muted now. All right, it might
I think
be
your network is bad.
network. That's right. Oh
Yeah.
no. Okay, if that's okay, Noku, I will just read the other two comments which you posted. Okay, so she wrote, some for fear of stigmatization went to buy medicine from. Hey.
Your network is
All right.
bad.
Yeah, the network is bad.
Yeah, all right. Okay.
You can read your comments.
All right, okay. So she wrote, some, for fear of stigmatization, went to buy the medicine from pharmacies or would go to far away hospitals where they wouldn't meet anyone familiar. And before the medicine was freely available at hospitals, many people died because of lack of finance to purchase from the pharmacies. So yeah, those are Noku's contributions in chat.
Yeah. So
And I
I
also
remember.
No, go ahead.
Okay. So I remember where I stay at my son's school, there was this child, a girl child, she was born HIV positive. So I think, I don't know how the other students find out. So one day she was coming from school and she was walking with my son. My son was carrying a bag. I think they were just talking as kids. So I remember I get about 4 or 5 people coming to me saying, Melody, we saw your son with this girl. We saw your son with this girl. So I was like, so? Say, you don't know that that child is HIV positive. It pained me like, so when my son came, I said, did you come to school from school with this girl? I said, yes, mom. I said, but people were telling me, what do you know about this girl? I said, Mama, everyone at school knows that she's HIV positive. It was so bad. Like, say, she doesn't have even friends. At break time, she's sitting by herself. At lunchtime, even going to school, coming home, she's by herself. So it was so bad. Like, the other students where she was like an outcast at school. So I think also the teachers at school must teach the students about this disease. Like, it's not like a death sentence. You can't make someone an outcast in a society.
Just to add on Lida, sorry. Just to add on Lida Melo, that happens a lot even in adulthood, where people will bully someone based on the fact that they're hanging around, And I think the biggest problem in Zimbabwe is we do not have a law that protects these patients. Let it be your decision to, number one, disclose and to do whatever you want with that information. But obviously, in Zimbabwe, we have no respect for that. And that is something that really has to start, where from even the doctors, respect your patients. Do not divulge your patient's information. Let them divulge it at the right time, when they've received counseling, when they've accepted it, when they've understood what they're going through. So that child should never have gone through that at all, because she's not going to give it to your son. She's not going to give it to anyone else. She's just
Yeah,
giving.
so it means if that kid, like, when she wants to be in a relationship, she'll go somewhere far where people don't know her. And I think she was like, I'm born with this disease, so it's not my fault. That's why she won't be open to her partner, like, HIV positive. She will just keep quiet, because after the treatment she receives from, yes, from within the society where she stays, she'll go far from where she stays, where people doesn't know her, and she will just have like many relationships, just like out of anger, you know.
Society is a mean one.
Yeah,
Society really has to do a better. I think now it's not about them not being educated about the disease. It's about finding joy in making the next person miserable because you are miserable with other things. So right
true.
now in Zimbabwe, I think that is one of the biggest things. It's not that they don't know anything about HIV; they know about it. It's not that they don't understand it; they absolutely understand it. I think it's just a mean society. Social media has become very mean too. It's vile. I mean, it's crazy. It's very good platforms, but sometimes it can be so mean. You know, mean with something that, I mean, it's a virus, it's a disease, it's you didn't go. I mean, yeah, some people say, oh, you went looking for it, but like I said before, not all of those people went looking for it at all. And I mean, if you're going to be promiscuous, most people that are promiscuous are going to be using condoms, from what I've heard and what I've noticed. They will use condoms, or but it's generally the married couples, polygamy, small houses coming in. That small house might have two other boyfriends. That one boyfriend that they have might be dating other people, and then it just keeps. It's a cycle. So I think Zimbabweans need to stop being mean. They just need to be, like just accepting to people's medical status. And like I said, it starts from the doctors, because I personally know doctors, senior doctors, that have zero respect for their patient and will go and divulge those type of information. It has to stop.
And that's the thing, like you say, because virgins, there are virgins who are HIV positive, like Antinoku said. She says nowadays our youths face another huge blow on the miseducation of the epidemic. There are many HIV positive virgins. Don't trust anyone at face value. Get tested before you indulge in sexual activity. Wait for marriage. Get tested and then get married. Because the thing is, yes, we might say that people were promiscuous, right? I can tell you that some of us, we did not get infected with the virus just by the grace of God, is what I can say, because I got pregnant when I was 18. Clearly, I wasn't choosing protection when I got pregnant, because I got pregnant before I got married. So, and I know I'm not the only one. You guys know, I'm not the only one. We can all talk about this, because you all know, Kuti, you made some stupid choices and made some stupid mistakes as well.
I'm one of those.
Because then we look back and you say, you know what? I could have been infected at that point. You don't know. Because you trust Kuti, and you trust mkomano wako and this, but you don't know where your boyfriend came from. And I can tell you, Kuti, I did not have a test. This is a negative test before I had sex for the very first time, because I just trusted. My partner is fine, but you cannot live life just trusting like that. It's important. Munoenda mese, mono test kwa mese, and you look at the test mese. Okay, takamira say before you continue on with your relationship. For those who are young, who are still going on, and like you said, even in marriage, it could be something that befalls you because your partner was unfaithful and didn't tell you, and you didn't even know there was a small house. And this is your partner. So are you going to be forcing your partner to wear a condom all the time and then they'll say, you don't trust me. It's very complex. It's a very complicated dynamic. So, and there are a lot of women that ended up HIV positive from partners who were straying, or a lot of men who ended up HIV positive from partners who were straying. I'm trying not to be too feminist. So, so all in all, I think it's very important for us to really educate, especially our children, because I think the problem is that this is a topic for another time, and I promise we are going to have a panel and discuss this. But the problem that I see often is that we are trying to raise our kids the way that we were raised. It doesn't work. It really doesn't. You know, we have a completely different generation, and they are dealing with things that we didn't deal with. They are, you know, this is a different time period for them. And so you can't expect what worked when I was being raised in 1980 or in 1990 to work for my kids that I'm raising in 2021. So we have to be able to have these frank conversations with our children, and to have frank conversations with each other about how to effectively raise our kids and how to effectively give them the information that they need so that they can make wise decisions.
Yes, absolutely. And drawing from something that you said that it was by the grace of God that some of us escaped this uh, disease. And that is so true, and something that's so important to, to inform the younger generation. Most times in our teenage years, we don't really take issues of faith, issues about God seriously. We think that our parents, our grandparents are, they are old fashioned, and we think that we have it made. We think we know better, but most people who have had the grace of God's protection in their lives will testify that it is very real. God's protection is very real. If you put your faith in Him, He genuinely protects you. Looking back as an adult now, I realize how many death trips I walked through, completely unaware of what I was walking into, completely unaware of what could have gone, so many things that could have gone wrong. And just realizing now that it was probably my parents' prayers that protected me, and realizing now when I'm praying for my children that my prayers are protecting them. They are walking around, they have no idea what they're walking into, but my prayers are protecting them. And so I envy some of my colleagues and friends who had the privilege of knowing God from an early age, and I realize, wow, they are way off ahead. They're way ahead in life because they knew God, and they knew His ways, and they walked in His ways. If you know God and you walk in His ways, He will save you from so many diseases, from so many deaths. And so it's something that I would just like to pass on to the teenagers, to the next generation, that please don't take this stuff for granted. When you hear people talking about God and His protection, take it seriously. When you get to our age, you will look back and you will wish you had taken you will wish you had taken this advice.
And to
Thank
add
you.
to that,
That's what I wanted.
I want to say, for those people who ended up infected, or those people who ended up sick in whatever way, God is not punishing you. It's, because you say, oh, maybe God is punishing me because I did this, I didn't follow, I did what was wrong, I had sex before I was married, but God is not punishing you. He's not a God like that. And there are a lot of things that happen, bad things that happen in our lives, that we can never understand, that we will never understand this side of heaven. And I used to always say there are things that I had a list, and I was going to go to God when we got to heaven, and I was going to be asking Him, why did you let this happen? Why did you allow this? But then, you know what? After I read the book of Job again, I was convicted, and I realized, who am I to want to question God in his glory, in his goodness, the perfect God. Who am I to question him? Why did you allow this to happen? Really? So I am at the point now where I will not be asking him any questions when I see him, because I understand truly that his ways are way higher than our ways. And even if it's something that I don't understand, I don't need to understand it, because I know that he is faithful and he will take care of whatever it is, even in the most dire circumstances, even in the most deepest, darkest night, he will be there. And just knowing that for me is such a great comfort.
Oh, yes, exactly. And even in our hard times, he is still there with us, and he's sustaining us, he's carrying us. And all we need to do is have faith in him. I know that during the 80s, 90s, there are some people who committed suicide when they found out that they were HIV positive. But if you look at it today, there are people who were born with HIV and they're in their early 30s, in their late 30s. So if you were to have faith in God and, stay strong in faith, knowing that even though I'm in this situation, God is with me, he would carry you through that phase whilst the drugs were being developed. And uh, once the drugs were developed and they were released, you'd be able to get the antiretroviral pills, and your life would be totally different. Whereas someone else may have already committed suicide thinking that a death sentence already has been passed over my life. So it is very important to know that God is with us even during the difficult times. All we need to do is to have faith in him and believe that he will carry us through.
Amen. Any last minute? I know we are over our hour. Any last minute additions before we sign off? Well, I'd like to say thank you so much to our panelists. Thank you for contributing and making this such a wonderful chat. And thank you to our listeners from all over the world. And Chuku Chisom, I probably butchered your name, I'm sorry. Watching from Ghana, thank you so much. And if anybody has any topics that they want us to discuss, please
don't
you
get
can
tested before they tend only
sorry
first.
you're
And then
breaking off. I don't
and the
yeah, the
people are
network
not
is really
so
terrible. Yeah, our network, I hope our next session the network will be better. So for anyone that has any topics, questions, whatever you want to discuss, please send to WhatsApp 1-601-760-2850 +1-601-760-2850, and we look forward to chatting with you next time. Thank you, everyone. Ciao.
Thank you. Goodbye.
Thank you, ladies. Thank you. Bye.